I'm Emma. I am a social media and marketing team member of Pre-Health Shadowing. Welcome to our live session today. Thank you for joining us. I'll be going over a quick startup presentation to welcome you all and introduce you to our program and various opportunities if you have not previously attended our shadowing sessions. So we are a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. Just a little PSA while we get started. We do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So if you have any recommendations for how we can make that better or how we can improve, you can email us at info@prehealthshadowing.com. If you want to stay in the loop and find out more about what we do and then also get updates for live sessions, follow us on social media. We are active on Instagram and TikTok, or you can sign up for our email list on our website to never miss a session. Since this is an international program, we want to know, where are you guys zooming in from today? You can drop it in the chat. I am currently in Atlanta, Georgia, in the United States. Okay. I see Tennessee, Illinois, Los Angeles, Romania. I don't know if I've personally never been on a live session with someone from Romania. That's super cool. Virginia, North Carolina. Sweet. All right, welcome everyone. So just some background before we get started, more on PHS. We have some wonderful opportunities for everyone as benefits of being a part of our program. If you're looking to get research experience, or if you drop the ball on applications this year, we are launching a research program that will allow students to connect with principal investigators, or PIs, as they conduct research in a plethora of topics, fields, and locations. This program is 100% remote, which means you can connect with anyone from anywhere. Some of the subsets of research this program offers includes diversity, medical education, student interest, health professional school matriculation, and mental and behavioral health. Students will have access to professional connections through seminars, which are one-on-one meetings, and have undergraduate mentors assist them with their projects. With that said, we are also offering the opportunity for students to become mentors in this research program. Applicants are strongly encouraged to possess the following strengths: data entry, data analysis, academic writing, collaborating with students, presenting data or concepts, and more. If you're interested in the research program or in becoming a mentor, please scan the QR code on the screen and apply, or check the chat for more info. We are excited to announce that we are hosting a bingo board social media event where you will be able to fill up a bingo board with each board having a specified dollar amount. To participate, all you need to do is post this on your social media platforms and get a group of friends to help you fill up the board. Check out our blog post for more details, or check out our Instagram in our highlight section. This will be there too. And I actually, Susan, I think, did the Krispy Kreme partnership end? Do you know?
I think this is still ongoing for the time being.
Okay. Well, good news for everyone. We have partnered up with Krispy Kreme for you to purchase 1 dozen donuts to enjoy with your loved ones. With a donation of $10, you'll be able to receive your treat while also helping us at PHS. More information and instructions can be found by clicking the link sent in the chat. Lastly, it's the perfect time to exercise with Pre-Health Shadowing's new Pledge Drive event. For this event, you'll essentially be able to work out and help raise money for an excellent and healthy cause. For every $5 donated to you, you'll be required to exercise for 1 hour. For more information, please visit our website underneath the blog section. Mask for Mask is an amazing woman-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID pandemic, those in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order. If you buy through this method, pre-health shadowing will also get the 10% of the proceeds, which is amazing because we're a nonprofit that runs solely off of the support of our community. If you want to be a bigger part of pre-health shadowing, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and more. We understand that as a pre-health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of the program and contribute your own unique perspective. Along with that, we take great pleasure in announcing the newly available pre-health shadowing leadership positions for the 2021-2022 academic year. Our organization welcomes students from all majors, education, demographics, and professional interests who are eager to make a difference in the field of healthcare. Students can take on leadership roles remotely and apply to any of the following positions listed on the screen. As a student-led organization, members of our team take on various roles that encompass project management, volunteer coordination, and collaboration amongst fellow peers. Additionally, each of these chief positions will be accompanied by possible assistant chiefs. Lastly, keep in mind that students are given the flexibility to create their own schedules. However, members are expected to commit a minimum of 5 to 8 hours on a weekly basis. So if you want to gain experiences in leadership and further your skills, go ahead and click on the link sent in the chat. If you have any questions, feel free to message one of the board members and we can assist you or direct you the right way. If you're still a high school student and you still want to get involved, we have started a program called HTP, stands for a high school training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize the hard work of all of our student participants in the program, so if you're interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the link dropped in the chat to have your work on our website. This will look great on CVs, applications, resumes, and more, so take advantage of this opportunity. Part of our mission at PHS is to promote diversity, and in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, an international student forum. If you have a mentor, professor, or professional that has inspired you and you think could contribute to these conversations, nominate them today using the link. We humbly ask that if you can donate to our program if possible. As you know, pre-health shadowing is completely student-run, and we are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. And if you're not financially able, we would ask that you could possibly send this link to someone you think can, so we can continue to support those who could not afford similar opportunities. Throughout the session today, we encourage you to drop any and all questions you have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session. Take good notes as our professional is going over their presentation, as there will be a chance to take a post-shadowing quiz assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned. And this will give you your certificate for participation in a virtual shadowing session. Lastly, if you can, we request that you turn on your cameras. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer in a time when socially distancing is so frequent in our lives. We also request that you make sure to mute yourselves, as this will ensure the professional has the complete and full attention from the audience. All right, we appreciate you for listening, and now I would like to welcome our professional for today. So thank you so much for joining us, and let me stop sharing my screen. And you are ready to share your screen whenever.
All right. Thank you, Susan, Emma, and Victoria for inviting me. And thank you all for joining me today. My name is Dr. Vidhya Prakash. I am an infectious diseases physician and faculty member at Southern Illinois University School of Medicine in Springfield, Illinois. I wear a number of hats, At the institution, I serve as Vice Chair of Clinical Affairs in the Department of Internal Medicine, where I'm essentially in charge of how the clinic runs. I'm also founder and director of our institution's Alliance for Women in Medicine and Science, where we're really trying to promote gender equity at our institution. And at the national level, I serve as director of the American Medical Women's Association, or AMWA, which is a national organization which is geared towards promoting gender equity and uplifting women in medicine and science. So before I share my journey, I'd like to give you a sense of what my practice is like and what teaching is like. And I'd like for you to, if you feel comfortable, share, go ahead and share your video so we can see you, or at the very least unmute, and go ahead and shout out answers. So I'm going to share my first case. This is an 18-year-old male who is on his high school wrestling team, who presents to clinic with a 2-day history of a spider bite on his left hip. And it's warm and tender to touch. And on examination, he doesn't have a high fever. So in infectious diseases, we consider a legitimate fever anything above 100.4 degrees. Anything below that is considered low grade. So he has a low grade fever of 99. His heart rate is 90, so that's a little fast. His respiratory rate, or how rapidly he's breathing, is normal at 16. And his blood pressure, or BP, is normal at 110/65. So you look at his hip, and it has a moderate amount of edema, which is the medical term for swelling. So he's got swelling, and he's very tender to palpation or touch. So when you press a little bit deeply, it's very tender. There's an indurated area, which is a woody feel. So anytime you have a skin and soft tissue infection, because of the inflammatory cells and the bacteria sort of clumping together, it can have this woody sort of hard feel. And you notice some purulent drainage, and purulent means pus-like drainage. So what are your thoughts about this? Go ahead and shout out. If this patient, you are the doctor, you are the healthcare provider, and this patient comes to your clinic, what are some of the thoughts that are going through your mind? Unmute or please use the chat. Trying to keep this informal, so don't be shy.
I guess the first thing that came to my mind personally was that based off of his general vitals, he's definitely not in, thankfully, a critical condition from the spider bite. Definitely doesn't look great, but it definitely isn't a life-threatening sort of insect or spider. Yeah, very good, Emma. So I'm going to push you a little bit. What would make you worried in those vital signs? So his vitals, what I just read to you, were not worrisome. What would have been worrisome? Definitely if he was, I would think, hyperventilating in some way, or I guess on the other side of that, maybe a really low respiratory rate. And then same thing, definitely with his heart rate, if his heart was super fast, or on the other hand, I guess possibly super low.
Yeah, very good, very good. Anybody else? So certainly, you know, if he had a fever over 100.4, if his heart rate was beating much faster, as Emma pointed out, if his respiratory rate was rapid, and if his blood pressure was low, okay, all of those point towards more what we call systemic infection, which is the whole body is involved, as opposed to localized infection, which is what we see here, where it's contained to the original area of infection. And so the fact that it's hot, it's really sore, it's draining pus, this is clearly an infection. So we'll go through some more cases, and we'll talk about what unifies all these cases together. So now I have another case of a 20-year-old male who comes to your outpatient office, and he is noticing really painful bumps along his hairline. So thoughts about this case? What do you think? Anybody? And use the chat. Do you think this is infected? Do you think this is an infection?
I would probably say no. It seems more like maybe an allergic reaction to something, or um maybe something got, I think it might be a skin related condition rather than an infectious disease.
Sure. I see somebody in the chat who says, okay, think it's irritation or rash. Thank you, Victoria. Michelle says it could be severe eczema. Very good. All great thoughts. Anybody else? Okay, so let's move on to the next case. So now you have a 40-year-old who goes to a company picnic and eats lots of different foods, including potato salad, pastries, and cold cuts. And within 4 hours, he's got nausea, vomiting, and diarrhea, which goes away on its own within 24 hours. So thoughts about what might be going on here? Is this infectious?
A picnic kind of and food jumps out to me as a foodborne illness, so not infectious.
Okay, so I have a couple of people also commenting that it's food poisoning, and one person said it's infection from food poisoning. Okay, great discussion, great thoughts. So this is a 54-year-old with a history of diabetes who presents with this open ulcer on the bottom of his foot. And an MRI image of the foot shows osteomyelitis, osteo being bone, itis being inflammation. And so osteomyelitis together is infection of the bone. So your foot doctors, your podiatry service performs a debridement, which is taking a scalpel and really cleaning it really well, and a bone biopsy where they take a needle, they take a snippet of bone, and they send it to the microbiology lab to see what grows. And it shows something called gram-positive coccyne clusters. So a lot of what I do in ID is we take what we call cultures. So we take the swab, we send it to the microbiology lab, they look at it under the microscope, and the image is what they're reporting here. Gram-positive, meaning it stains positive or purple on the gram stain, and in clusters, exactly what it sounds like. It looks like a bunch of grapes. And so what are your thoughts about this? Is this an infection? Yeah. Christy Victor, osteomyelitis probably due to Staphylococcus aureus. Excellent. So Staphylococcus aureus is the pathogen that you see on the gram stain, and then the culture takes a couple of days to grow. And indeed, this patient grew Staph aureus. So now you have a 20-year-old female who was recently diagnosed with cellulitis, who comes in with a super high fever, a sunburn-like rash that you see here, and vomiting. And so on exam, her temperature is 102.5, so clearly above 100.4. Her heart's beating fairly rapidly at 110 beats per minute. It usually should be around 60. Respiratory rate is a little bit higher than usual, 20. It should be about 16. And you notice her blood pressure is fairly low, 80/50, not 110 like our other patient. And she has normal oxygen saturations without any oxygen. But she's confused on exam, and she's got this diffuse, what we call macular rash. Macular meaning that it's flat. It's not a raised rash. And her kidney function is out. So her baseline creatinine, which is a measure of your kidney function, is 0.5, and hers is above that, which tells you that the kidney's not functioning the way it's supposed to be. And her AST and ALT, which are markers of liver injury, are high as well. So her liver's injured. And her platelet count, which helps you to clot your blood, that's low. So she's probably not clotting her blood well. So here's my first question: sick or not sick? Is this patient sick or not sick? Sick, yes. Tell me why. Why do you say sick? I completely agree. Go ahead and shout out or use the chat. Tell me some things that tell you this patient is sick and probably needs to be in the ICU. Yes. Organ function damage, hypotension, tachycardia, high fever, confusion, right? Altered mental status, that's an organ system that's down. Liver function is down, coagulation is down. She's hypotensive. So this is actually a case of toxic shock syndrome. And so the reason I clustered all of these together is that they have a unifying pathogen, which is Staphylococcus aureus. So the wrestler had Staph aureus, an abscess, which is a collection of pus that grew Staph aureus. This patient had food poisoning due to Staph aureus. So, you know, when you go to company picnics, the potato salad, if it's been sitting out for a longer period of time, it can cause Staph aureus. This is a case of folliculitis due to Staph aureus, so infection around the hair follicle, osteomyelitis due to Staph aureus, and like I said, a toxic shock syndrome due to Staph aureus. So I went through these slides just to give you a flavor of, this came directly from one of my lectures for my medical students. And I go on to go into details about Staph aureus, about what it looks like under the microscope, its virulence factors, the different types of infection it causes, and how it's treated and what the outcomes are. But the majority of what I want to talk to you today has to do with my journey and how I got from my pre-medical school days in college to where I am now. So I grew up in Ohio. I grew up in Cincinnati, Ohio. I am an immigrant. So my story is interesting. My heritage is Indian. My mom and dad were both born and raised in India. My dad was a research scientist in France. So he and my mom got an arranged marriage in India. They moved to France. And I was born, me and my brother were born in the country of France. And from there, when we were toddlers, we immigrated to the United States. I was really little, and I remember being naturalized with my parents when they said the oath to become US citizens. So I'm an Ohio girl through and through, and I grew up in Ohio, and I went to The Ohio State University. Sorry, Michigan fans, and I know you beat us this past weekend. I'm still recovering. But yeah, I went to The Ohio State University, and so you're going to see College of the Arts and Sciences, and you're going to be like, what? What about the College of Mathematics or College of Engineering or College of Biology? So here's where my story gets interesting. We go into college and we think, if I'm going to be a doctor, I have to major in biology or chemistry to be a doctor. And I'm here to tell you that that is not necessarily true, because I majored in English as an undergraduate. And I didn't double major in one of the sciences. My major was English, and I took the prerequisites to get into medical school. And here's what I loved about it. Number one, it fit with my passion. I have always loved to write. I love reading, and I didn't want to get away from that. And when I went to the orientation, we had a very dynamic speaker who told us, you can fit both of them in, and you can fit both of them in comfortably into a 4-year curriculum. So take the necessary pre-medical requisites, complete your major, and in fact, it can be a bonus because you stand out. Because so many people are science and math and engineering majors, when you are majoring in something like the humanities, it actually makes you stand out. So whether you want to major in the humanities or use it as a minor, it actually sets you apart. So I went through those 4 years taking things like biology, biochemistry, organic chemistry, and Faulkner's Light in August and the American Renaissance and creative writing. And I can't thank that professor enough for giving me that advice, because I helped to marry those two passions during those 4 years and felt deeply fulfilled by the time I graduated. And in addition, I found time to volunteer at the local hospital, and I was able to ask around for research opportunities and was able to do a little bit of research. And I do think that those things also helped me in my quest to become a medical student, because they want to see somebody who's well-rounded. And so again, the volunteering and research, I didn't do it in such a way that it took up enormous amounts of time. I would volunteer when I could on weekends, and I made sure I selected a research project that was doable within a 4-year period. So that was the Ohio State University and my experience there. So I am a veteran of the United States Air Force. So what is my Air Force story? it's interesting because I have two uncles who are very high up in the Indian Army, and they wanted somebody in their family to carry on the tradition. And what's interesting is that they went through all of my male cousins first. I was last on their list of carrying on the family tradition. And when one by one, they all said no, they were finally left with me. And I thought about it, and I thought, I'm really grateful. I have such gratitude to this country, because my parents taught me that this is the land of opportunity. And I had more opportunities here than I would have in my native country, which again, I'm very proud to be Indian too. So it was a great way to give back. And it's just funny because I talked to my uncle, and within a week, I got an HPSB Health Profession Scholarship Program flyer in the mail randomly. So I met with the recruiter and was told that they will pay for all 4 years of medical school, provided you pay back 4 years in a military hospital. And so it just seemed like a very good deal. And in retrospect, it was. So I joined the HPSP program at the end of college and applied for medical school, interviewed, and matriculated into the University of Cincinnati. So these are actually my uncles that I wanted to show you. This uncle was a full colonel in the Indian Army, and this uncle was a brigadier general and director of armaments for India's army. So the why did I join? It really had to do with pride in my country, my family, being honored to give back to my country, service and gratitude. And I would ask any one of you, if you're interested in doing HPSP or joining the military, if it's not one of these things on the list, don't do it. If you're just doing it because you want to get medical school paid for, a commitment like this has to go beyond the financial incentive. It has to do with either honoring your family or your country. There needs to be that innate desire with the country in mind. Otherwise, it just will not be worth it. And that's my big piece of advice that I want to give. So I still remember I was in college, and at that time, we didn't really have internet or even cell phones. I had a landline that I would eagerly wait for it to go off. And I remember getting the phone call offering me a spot into medical school. And it was seriously, you know, one of the best days of my life. So I moved from Columbus back to Cincinnati, which is where I grew up. And I started medical school. And the first 2 years of medical school was really being in class all day and studying for many hours, whether it was in the library or at home. I did a lot of reading and studying those first 2 years, and a lot of work in the microbiology lab and in the anatomy lab, where we dissected cadavers. The second 2 years of medical school was intense in the hospital. And I was lucky, I was in an apartment that was walking distance to the hospital. So I wouldn't have to drive, I would just walk, you know, to the hospital every day. And I loved all of my rotations. I can't say there was one rotation that I didn't like. I loved neurology, and I really thought I was going to be a neurologist until I did internal medicine. And then that was it, there was no turning back. And in particular, it was the infections, patients with infections in internal medicine that I loved so much. I'm going to take a question real quick. Currently an Air Force ROTC cadet applying for HPSP, application process, Air Force medicine stand out compared to civilian, and what's it like to practice medicine on active duty? Yeah, so I'm going to get into that in a little bit. So just sit tight and I'll let you know, Vivian, what that whole process is like. So yeah, like I said, I decided I wanted to go into internal medicine. And so the match process is separate from the civilian process. And so you still find out with the rest of your peers where you're going on the same day. But the timeline before then is a little bit off. Anymore, what you do is you pick the Air Force base that you really want to go to for training. There aren't that many, at least for internal medicine, I can speak to. And what I did was I did an audition rotation in San Antonio. I really wanted to train at SawShek, which was my, program. So I spent a month there. I got really good letters of recommendation, and I interviewed there during my audition rotation. So that's what the process was like. And then eventually, I got the great news that I had matched in San Antonio. And so the program is SawShek, San Antonio Uniform Services Health Education Consortium. This is Wilford Hall Medical Center, which used to be a hospital, but it's now a big outpatient clinic. And this is Brooke Army Medical Center. And so all of my internal medicine training was at Wilford Hall Medical Center. And then when I applied and got into infectious diseases fellowship, most of my training was at Brooke Army Medical Center. So Vivian, you asked how training was different than civilian. Something that I had to get used to was, we went through training. So the summer before medical school, I actually had to go through boot camp. And it was one of the most challenging, several weeks of my life, where it was intense classroom and physical fitness training. And we even had a physical fitness test where if you did not pass, you would not get the scholarship. So it was pretty intense. And you learned how to wear the uniform, and you learned how to salute, and you learned to say ma'am and sir, and you learned to tie your hair back. All of those customs and courtesies were things that I had to get used to being a military trainee, because you always showed up in uniform. Unless you were on call and in scrubs, you were always in uniform and in regulations, and you knew to salute every time you saw somebody outside of a higher rank, and you always knew to call people ma'am and sir. But otherwise, I think the training is comparable to what you would get in a civilian program, and I will brag a little bit. I think it's second to none. I am grateful to my educators at both Wilford Hall and BAMC for really state-of-the-art education. So after that, after I was done with internal medicine and infectious diseases training, I had to pay back my 4 years. The Air Force had paid for 4 years for my medical education. And so I was transitioned to Wright-Patterson Air Force Base in Dayton, Ohio. And I practiced there for 4 years, and I had the privilege of taking care of both active duty soldiers and veterans. And the common infections that I have cared for in the Air Force are not that different from what I care for in the civilian world. Although at Brooke Army Medical Center, I took care of a lot of patients who had amputations or severe burns from their deployments overseas. It's a very special group of people. I had the honor and privilege of caring for them. They're some of the most difficult and poignant moments in my career. I still have trouble talking about it because it was hard emotionally to do that. But that is one distinction, I would say, from my civilian career of the types of patients that I was able to take care of. And I had the privilege of being a program director in the Air Force, where I trained young residents to become faculty. And that was really a highlight of my career, to be able to give back that way and train other residents. So my husband, who was also active duty Air Force, he and I, at the end of our 4-year commitment, had a serious talk about whether we were going to make this a career or not. And ultimately, we made the decision to leave the Air Force. So we were both honorably discharged, and we found Southern Illinois University School of Medicine, which is where I am now and where I practice. And so here, like I said, I have a number of leadership positions, but most important to what I do is taking care of my patients and teaching. I provide care at 2 large hospitals. So a primary care provider in the hospital who has a patient with an infection who needs help with managing antibiotics, they call me. So I will help treat their toxic shock syndrome or the osteomyelitis or the abscess. And I also have a clinic that I see patients in once a week. I have a lot of patients with hepatitis C. I have some patients with HIV, and then a wide variety of other infections, like infections of the joint and the bone and the lungs. So it's a great job. I feel very fulfilled. It's been a wonderful experience. I did want to end with my role as founder of AWIMS, which is our Alliance for Women in Medicine and Science. So we have 5 initiatives. We do educational sessions quarterly. These are my 2 co-chairs. And we have a he for she pathway where we have men and other allies who are helping to propel the women in medicine movement. We recently got a grant to start a research initiative at our institution. These are all of the researchers, women researchers who have been leading research initiatives and projects at our school. We do a lot in the community. We have helped with COVID-19 testing. We cook meals for the homeless. One of the most meaningful initiatives we were a part of was Habitat for Humanity, where we help build homes literally from the ground up. Very, very meaningful, very good work that we do here. We have a whole mentorship arm where we do like speed dating style mixers, but with mentors and mentees, which is a lot of fun. And we offer mentorship to everybody at the institution. And then we have a wellness room. We have a dedicated room where people can go to do yoga, they can relax, they can meditate. It's just a place to unwind. And we've done offsite retreats on things like trauma. So a very robust mindfulness and wellness arm. And then every year we have a professional development conference. The pictures you see here were pre-pandemic. But even during the pandemic, we've continued to connect virtually, which has been very, very rewarding. And we won an award. We were highlighted into Insight into Diversity's magazine for being an inspiring affinity group. And we've also been recognized by the American Medical Association and the NIH. So it's a great group, but it's the power of everyone together. And that's why it's an alliance, because it's not just the women, it's not just the doctors, it's everybody in it together for the sake of gender equity. I love this by Liberian peace activist Lima Gabawi, who says, you can never leave footprints that are that last if you're always walking on tiptoe. And this is a motto that I live by, not only for women in medicine, but for every one of you. As you expand your careers, don't be afraid to take risks. Don't be afraid to make a splash. That's how you make change, and that's how you move ahead in your careers. And I just want to end with gratitude. These guys are 10 and 12 now, but of course I have to share my favorite pictures of them when they were smushy little guys and so cuddly, and now they just don't have time to cuddle with their mom. So this is how I envision them. This is Eric, and this is Ethan. This is them several years ago, and this is me and my husband and my kiddo several years ago. Really the light of my life. They bring me joy, and I can't imagine my life without this crew here. And finally, I wrote a book. If anybody is interested, it's called Learning to Listen. It's my memoir. And I talk about my experiences growing up in the United States, facing racial bias, facing gender bias throughout my career. And I talk a lot about meaningful interactions with my patients. So if you are interested, this is my book. And that leaves time for questions. That's the rest of my, that's my presentation. So I'm going to stop sharing. And I just want to thank you for your time.
Okay, thank you so much, Dr. Prakash, for going through the presentation and just giving us a little bit of like insight into your medical journey and your very adventurous like pathway of how you are essentially how you reached the point you are right now. So thank you for sharing that and just giving us insights into how you can essentially just you can become a doctor or a physician in a very different kind of pathway. Like it's not very a one-way journey kind of thing. So thank you so much for giving insight into that point. And right now we are going to move into the Q&A session. So throughout the session, we have been collecting a few questions that the students have personally just like private messaged us or have been typing in the chat. So the very first one that I see is why specifically did you want to become a doctor? So like what were the sources of motivation behind this passion?
Yeah, it's interesting because I told you I've always loved to read and write. I was always the girl with a little notebook and writing stories, and I really thought I was going to be a lawyer for the longest time. And then in the 9th grade, I took an anatomy and physiology class, and my teacher's name was Mr. Allison. And he was so enthusiastic about anatomy and physiology, and his zeal was infectious. And so I got really into it. We looked at the anatomy of the fetal pig, and I dissected the fetal pig and learned about all of the organs. And that's what fueled I think that's what inspired me to become a doctor. I realized I was really passionate about learning about anatomy and physiology, and then took a biology course about human anatomy and physiology. And that was it. I didn't want to be a lawyer anymore. I realized I wanted to be a doctor.
And honestly, I can resonate with that so much, because that was honestly, like, it sounds kind of ironic, but that was like that was my starting point as well. Because I was in a program in high school where they were just inviting us to go into like I was in 8th grade, and invited us into like a high school lab, and they were like, "Oh, let's show you this," and like they handed me the scalpel, and I'm like, "Oh my God, like this is it." So there's like, it's a weird starting point, but I feel like in a sense we kind of resonate in the sense like once you really there and you feel it, you know, like it's your calling.
Absolutely, Susan. I had the exact same feeling. Like I just knew. It was in my bones, it was in my gut. It was just, this is what I'm meant to do.
Yes, thank you so much for sharing that. So another question that we have is, can you speak about your experience as a woman in medicine? So what are some of the stuff that you face on a daily, day-to-day basis, and like how do you manage some examples of like pushbacks or like microaggression, for example? So how do you handle stuff like that?
Yeah, sure. So I talk about a lot of these experiences in my book, and it's not something that I have just experienced as a woman in medicine. It's something I've experienced as a girl to a woman. So as early as my childhood through college and through my career. So specific microaggressions that I can talk about professionally, especially if you're the sole woman in a room and it's mostly men, something that we've struggled with is you will make a suggestion and everyone sort of ignores you. And then a man will bring up the same suggestion and everyone thinks it's the best idea. So the Obama administration, the women in the Obama administration started a process called amplification. So if they heard one of their women colleagues bring up a point, before anybody else could grab that for themselves, another woman would say, "You know what, Susan, that is a fantastic suggestion." And another woman would say, "I agree, Vidhya. I love Susan's suggestion." So that way you're sort of building each other up to make sure that it doesn't get taken away from the initial person who brought that up. It's sad, but that tends to happen a lot more than, you would like to admit, is, not being credited for your original ideas. I think women in general, especially during the COVID-19 pandemic, what it's uncovered is that women disproportionately take on the child and elder care responsibilities. And so a lot of women have exited the workforce. I have a friend who's a physician who went to part-time and then eventually quit because she said, "I don't have a nanny. There's nobody to stay at home with my kids while they're on Zoom for the first year of the pandemic." And so that narrative is fairly pervasive. So those are just two of many examples that I can give of what women struggle with in academic medicine.
And thank you so much for sharing those examples. I feel like those are very common points that we should not be neglecting now, especially with the progress that we're making in society. So it's really great that for example, I think you mentioned that you were on the board for I think an initiative for like women in medicine, I believe, in the beginning. So I feel like that's very important to like just support more women in medicine and just kind of give them a voice and like give them a chance to like not think that medicine is impossible just because of the other stuff that are behind them. So thank you so much for sharing your experience on that.
I will also add to that, Susan, that men and anybody who doesn't identify as a woman have a role in this. It's called allyship. So people of other genders other than female can amplify what a woman is saying, and support them and find ways to amplify their work, amplify their ideas. and make sure that they get credit for what they do. And that's why it goes back to the idea of an alliance, right? We all need to be in it together. It's not just the women for themselves, it's everybody in it for gender equity, because it benefits all of us when an environment is equitable.
Thank you so much for that message. It's very powerful. Thank you.
Mm-hmm.
So then next we have a bit of a fun question, was kind of like back to medical school, but one of our students is wondering, what is your biggest challenge that you encountered in medical school? And then if you can also kind of talk about your favorite memory from medical school.
There are so many. Oh my goodness. Well, I have so many favorite memories. You know, it's funny when you ask me what my biggest challenge is, that's hard because I just loved medical school. I just have to say, when I look back, I loved every minute of it. Even those first 2 years of, you know, studying like crazy, that was fun for me because I just enjoyed the subject matter and I just soaked it up. And it was so much fun. I will say call and overnight call was a little bit tough for me. It's hard for me just to jump back into my routine if I'm sleep deprived. So that was a little bit hard, not only during medical school when I was on rotations, but especially during residency when I did night shift. That was hard for me. And some of my favorite memories from medical school were in the anatomy lab. I had a great group. There was 4 of us in our group, and you know, we were very respectful to our cadaver and dissecting, but we had a lot of fun in the process. And we used humor to sort of get through those grueling months. So those are some of my favorite memories in medical school. I saw a question in the chat about, was being in the Air Force difficult? No, it was not difficult. If I had to say there was a difficult part, it was the physical fitness part. I'm not a runner. I'm not an athlete. I never have been. So keeping up with those requirements. So once a year, you have to pass the physical fitness test. You have to run in a certain period of time. You have to do sit-ups and push-ups. That's hard for me. That is. And that's something that I haven't had to deal with outside of the Air Force.
Okay, thank you so much for answering our students' questions. So the next one that we have is, so what would be some ways to avoid burnout as a physician, and have you personally experienced burnout, and how did you deal with it?
Yeah, I have experienced burnout. It was actually not too long ago, about 2 or 3 years ago, where we were really understaffed. There were only 3 of us in the division when there should have been 6 or 7. And I was on call every other week, pulling call every other weekend, and I was perpetually exhausted. I was physically exhausted. I was emotionally exhausted. I was starting to lose my sense of humanity. And so the way I dealt with that was having an honest discussion with my division chief and saying, you know, these are my limits. And, you know, we need to look at how we're distributing our work a little bit more. We need to talk about how we can be flexible with our work hours a little bit more, and then asking for help. We, especially, I've noticed in my experience with a lot of my women colleagues, there's shame in asking for help. You don't want to admit that you have a nanny or that you have a housekeeper. Somehow there's shame in that, or that you ask your parents or in-laws for help. I have no shame in asking people for help. And I don't think I could have come this far without asking for help. And, you know, if you struggle with depression, seeking help for that, we have to take the shame out of mental illness. There's nothing wrong with seeking counseling or taking an antidepressant and taking care of your mental health. We must take the shame out of that. And that's how we build each other up as well, by taking the shame out of mental illness. So giving yourself permission to take care of yourself physically, mentally, emotionally, asking for help, those are the ways that I help deal with my burnout.
Yeah, thank you so much for sharing that. And honestly, that was such an honest response, because like I resonate so much with that. Because normally, I don't know what you would call it, but typically because we're doing pre-med, right? So you're constantly on the grind. So first of all, there's like 2 points. The first point is that as a pre-med student, you almost feel like ashamed to ask for help because everyone's so competitive around you. So you feel like if you ask for help, that means you're not good enough and that someone else is better than you. So I just really want to highlight that point, that if you really do need help, just ask for it, because at the end of the day, you're benefiting from the help that you're asking for. So just if you need help, just speak out. And then the second thing with the mental condition thing is that I actually experienced this a few weeks ago, because midterm season, final season is hitting really hard right now. But I just guess I didn't really take a step back to really just focus and like understand how I was mentally. So in that time period, I was just extremely stressed, until one of my friends was just like, maybe you just have to like take a step back and just kind of like understand where you are mentally before you keep pushing. Because if I keep pushing, you're not really helping yourself, in the sense that by like you're not moving forward with it, because the mental strain is still going to be there, and while you're trying to add more burden onto it. So I just really want to like I'll stress the point that you were making before about like just being aware of your mental health, and just asking for help is okay. So thank you so much for sharing those tips and advice, especially for pre-med students.
Yeah, and thank you for sharing your personal story, Susan. You know, you have taken us a step further to taking the shame out of it. There is no shame in this. It's okay. You know, it's okay if you're overwhelmed, and it's especially okay and necessary to ask for help.
Yeah, definitely. Okay, so the next question that we have is, what is your favorite and least favorite part about the current job that you have?
My favorite part is the people. I will always go back to that over and over again. I love my patients, and I love the people that I work with, whether it's my colleagues, our leadership, or the students and residents that I work with. That's my favorite part of my job. The least favorite part of my job is some of the technical stuff. So we have an electronic health record, you know, that we have to keep up with. I'm sure you've heard of this from other faculty. It's a necessary evil, you know. That's something that I struggle with. But otherwise, I love my job and I love the people. You know, there's a question about IMGs, international medical graduates. I have had nothing but the best experience with IMGs, and have been so impressed and so inspired by the IMGs that I have worked with. You know, their level of grit, courage, grace, I really have been blown away by IMGs that I've worked with, and I've had nothing but the best experience. And yeah, I'm happy to share my email in the chat.
Okay, thank you so much for answering the students' questions, but we do have a follow-up for the previous question. So do you have a memorable like story or like experience that you have from being a physician?
I have so many. I'll share one of my favorite stories, and that is of my patient with HIV, who was a stylist. And this patient did not feel the need to take his medication. He thought, well, I've been doing fine. I haven't had any problems. I don't need to take my HIV medication, and you're not going to make me. And this was every visit. It was to the point I would cringe when I saw his name pop up on my schedule, because I'm like, this guy, I mean, I can't keep doing this. So one day we got into a pretty heated discussion, because today I wasn't going to back down. And I started going through the gory details of all the horrible infections that he could get if he didn't take his medication, and about death and dying. And finally, he stopped me mid-sentence, and he put up his hand and he said, and by the way, you have split ends. And I'm like, are you really going after my hair right now? I do not have split ends. He said, yeah, you do. I'm a stylist. I'm sorry, I noticed these things. So then we started arguing about my hair. And he said, turn around, let me show your resident. So he had my resident stand next to him, and he pointed out how awful my hair was in the back, you know, going through all the split ends. So I was exasperated, and I turned around. I said, look, I'll make a deal. I will clean up my hair if you take your meds. Can we at least agree to that? And he said, fine. So we shook on it. So the next time I saw him, there were no pleasantries. We just nodded to one another. I would greet him at the door. We would nod, and I would walk up to him, turn around, and he would inspect my hair. And then I would turn around and tell him what his viral load was. And during that process, we started to get to know each other and really like one another. I got to know about his family. I got to know about a tragedy that happened to him where he lost his child in a car accident, which was a really fresh and painful memory for him, even this many years later. So I got to know him on a really personal level. And for the first time in 10 years, he started taking his meds. And his viral load was controlled by the end of that. And my hair, I cleaned up my act with my hair. And it's funny, by the end of it, I decided to surprise him at his salon. And he gave me the best haircut I ever had in my life. And as he was snipping away, I talk about this in my book, he whispered to me, he said, you know, if you ever leave Springfield, I will come and I will move to where you are. And so that was probably one of my most meaningful patient experiences.
For sharing that. Honestly, that's a really fun story to just talk about. I never imagined going into that question that I would get a response like this. So honestly, that was very interesting. But you know what? Sometimes it's just these quirky stories that really get you through the day. So thank you so much for sharing that. And then we have a student that asked the question. So from your background info, I saw that you're an AMWA Rural Health Committee. I don't know much about rural medicine, but I'm interested. Can you speak more about that?
Yeah, so I would say rural health now more than ever is really suffering because of the pandemic. You know, people who have broadband access and internet, sure, you know, they can have telehealth visits, but what about our patients in rural health communities? And what about the doctors who live in those communities? They're really struggling. So especially in Southern Illinois, where I practice, we have a lot of rural communities where we have physicians practicing and struggling. So I feel, and I'm proud that Illinois has really stepped up to the plate to look into this matter more. Our outcomes are poor in kids and adults who live in rural health settings. The providers who live there are under-resourced. So we have to do, number one, we have to do more to improve broadband access in those areas, provide more resources to those areas and make them a priority. And so the Rural Health Committee in AMWA is a part of equity, diversity, and inclusion. So we're really trying to mobilize the rural health community in AMWA to address those very issues. There's a lot of isolation for providers who work in rural health communities. You know, I work in a busy academic practice. I will see 10 to 15 other faculty members in a day. A rural health physician, most of the time, it's them in one isolated area. So we have to address that isolation as well. Lots of opportunities for rural health, lots.
Yeah, thank you so much for sharing the insight on that, on the more rural side, because I do understand, like I've read several papers that kind of just discuss like the health disparities and like the lack of just resources from the rural areas, especially because of like COVID kind of highlighted that issue. So if anything, the pandemic, if anything good out of it, we've kind of highlighted there's an issue within the healthcare system, especially with like an emphasis in the rural communities. So thank you so much for sharing that with us. And then we have another student asking a question. Was there a role model in your life that kind of motivated you to pursue your profession?
I have been extremely lucky to have had many role models. I would say first and foremost is my mom. My mom is my rock, and she has been my greatest champion throughout my life, and especially throughout my career. You know, I was the little kid who loved to write, and something that's really special, I talk about this in my book as well. I had this little Hello Kitty notebook. It was like my favorite possession growing up, and it had a matching Hello Kitty pencil sharpener, and eraser in a little vinyl bag. And you knew where I was if you knew where that notebook and kit were, because wherever it was, I was, because I was always writing. And one day, she presented me with this beautiful silk bound book. And it was a book with all of my stories typewritten. So what she did was at night when we would go to bed, she would take out my Hello Kitty notebook and she would, using the typewriter, our old rickety typewriter, she would type each one of my stories. And she bound it into this beautiful silk bound book, and she attached my picture on the inside cover, and she wrote a little about the author in it. So it was my first book, but this was the type of mom I have, right? This is the type of mom I have. It was her way of telling me, if this is your passion, this is what's possible. When I said I wanted to be a lawyer, she taped pictures of Sandra Day O'Connor, the first woman Supreme Court Justice, to my closet door because she wanted to show me, women can do this, you can do this. So she stands out as my prime role model because she has always told me, you can do this, you are capable, you can do this.
Yeah, thank you so much for sharing your personal experience with us. I feel like just from the story, I feel like your mom is a very wonderful woman. Just like honestly, the typewriting thing, it really like touched me in a sense that I don't know. It's just the amount of like care and love that you have for your child to go through all of the stories that they write and just to type it up and then like just like put it together in a really small thing. Like it's a very like not a small gesture, but like it's a kind of like a side gesture, but it means so much with the stuff that she's doing. So thank you so much for sharing that experience with us. Another question that we have, this is more of a fun question, but I think you kind of mentioned this already, but say if you didn't really pursue the doctor path, what would have been the second choice?
Oh my goodness, that's hard because I can't imagine doing anything else. But you know, interestingly, it probably would have been along the lines of writer or lawyer or something, you know, in that continuum, if I had to pick something.
Okay, thank you so much for sharing that as well. And we are actually at our very last question. So this student asked, do you have any future career goals as like what do you want to pursue in the future with the current stuff that you're doing?
Yeah, so I will never stop seeing patients. You know, they have this idea in academic medicine, or what I've been warned is that, you know, as you take on leadership positions, you have to step away from patient care. And I made myself a promise. You know, I talked to you about my hairstylist. I will not be fulfilled if I don't have experiences like that. I went into medical school because I wanted to treat patients. And I cannot say I am Dr. Prakash unless I have patient care somewhere in my pathway. So patient care is something that I will always continue to do. And I feel just as strongly about teaching. I will never not teach. I have to include teaching, you know, in my profession. I am really looking more into more leadership and administrative roles, both at my institution and statewide and even nationally. Statewide, I'm leading a health equity team. I'm on the Council for Women and Girls in the state of Illinois, and we led a health equity summit. And I want to see where that goes because I think health equity, where we have seen inequities uncovered by the pandemic with our Latino, African American, and Native American communities disproportionately affected, I really want to change that. And I want to be in a leadership position where I do that. And I'm also leading a diversity and healthcare task force. I want to make sure there are more people who look like me. I want to make sure that there are more, you know, women in healthcare. I want to make sure there are more providers who are Black, who are Latino, who are Native American, who are LGBTQIA, who are not necessarily, you know, in what we call the abled community. I want to see more diversity in the healthcare workforce because we certainly have a diverse patient population. So to give them the best care possible, we need to diversify the healthcare workforce.
Thank you so much for the response again. And this actually comes this comes to the end of our live session. So thank you again so much, Dr. Prakash, for joining us and just speaking about your life experience as a physician and a woman in the healthcare field. So thank you so much for joining us and just talking to our students about your journey and all the case studies you presented, as well as the fun stories that you talked about, especially with your hairstylist. So we really appreciate that. And then from now, we are going to go into our wrap-up presentation. So at this moment, if you have something or you're busy, you are free to go. And I just want to really just thank you so much again for coming and joining our live session. But you are free to go now if you are busy. So yeah, we're seeing a lot of thank yous in the chat.
Susan, I especially want to thank you. You did a great job of communicating with me before this, and you moderated this Q&A very well. So many thanks again to you, Emma and Victoria, for having me. And thanks to all of you. You've been a wonderful audience. I appreciate your engagement. And I wish you all the very best. Thanks again.
Thank you.
Thanks.
Okay, so Emma, you can get started with the wrap-up presentation now.
All right, I'll share my screen again. Okay. All right. So thank you everyone for joining our presentation today. I definitely learned a lot, and I hope everyone else did, and gained some insight and some inspiration and information from the session today. So considering this, we would like to encourage everyone to reflect on the session. What brought you to the session today? What are 3 major takeaways that you got? And what do you want to learn more about? This writing a reflection is not required. However, we encourage you to submit it to our website for publication for recognition of your hard work and to enhance future applications. I would like to mention once again at the end of the session that PHS is launching a research program that will allow students connect with PIs as they conduct research in a plethora of topics, fields, and locations. This program, once again, is 100% remote, so you can connect anywhere and to anyone. This is an 8-week program. For more information, please fill out the interest form sent in the chat below, and we will get back to you as soon as possible with additional details. And there is the QR code for the research project also, if you did not have the opportunity to scan earlier. Once again, we are hosting a bingo board social media event where you'll be able to fill up a bingo board with each board having a specified dollar amount. And to participate, all you need to do is post this on your social media platforms and get a group of friends to help you fill up the board. Additionally, we have partnered with Krispy Kreme, and this is the donation of $10 to receive a dozen donuts while also helping us at PHS. Once again, the link will be in the chat or on our social media. Our pledge drive is being able to work out and help raise money for an excellent and healthy cause. For every $5 donated to you, you will be required to exercise for 1 hour. And for more information, please visit our website underneath the blog section or check out our social media. If you want to learn more about PHS and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. We're also accepting new team member applications if you want to take on a more active role in PHS to lead projects and initiatives to be up here with us. And we are about to transition to a new structure in PHS. And so there are plenty of new opportunities and positions open if you are interested in becoming a bigger part of PHS. Once again, we are humbly asking that if you are financially able to donate so we can continue running our program and to keep it free for all of our participants, So if you or someone can afford it, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we, of course, just ask that you spread the word about pre-health shadowing to reach as many students as possible. Now for the part we have all been waiting for, earning a digital certificate for the virtual shadowing hours from this session today. So first, you will go onto our website and find our professionals course page under shadowing sessions. Next, you can take our quick 10-question multiple choice quiz based on the content from the session today. You have 30 minutes per attempt to earn a 70% or higher to get your certificate. We know that sometimes technology can be difficult, and for this reason, allow 2 attempts to take the assessment. But if you run into any difficulties, please go ahead and contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting 30 minutes to an hour after the session to take the quiz, which will be open indefinitely. Once you have passed, you can click the Finish Course button at the bottom of the professionals page and download your certificate verifying your own virtual shadowing hours. If you did feel like you missed a part of this session today, or if you want to go back and review it, or if you want to view other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings from any session. You can also find them via the professional pages on our website and take the post-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events so you don't miss out. And once again, thank you so much for joining us today and supporting PHS. Please stick around if you have any questions for myself and other team members, and we'll be happy to answer them. This shadowing session is officially over, and I invite you all to log off. Have a wonderful rest of your day.